food. We are on to our STS data. This last time it showed that we had high readmission rates for the congestive heart failure patients, meaning that we had a high number of patients with heart failure get readmitted within 30 days, which Medicare does not like, so we have to fix it. Any ideas on the table?
Well, what if we implemented a nursing theory such as Orum's self-care deficit theory? According to her theory, people have a natural ability for self-care, and nursing should focus on affecting that ability. And we could apply it to like a discharge curriculum to determine whether patients have a self-care deficit before they leave the hospital.
That's a good idea. Assess kind of what they need before they go home. Okay, what else on that?
Well, doesn't her theory like address the activities of daily living that we learned about in nursing school, Maslow's hierarchy of needs or whatever?
I think I remember that from a presentation.
Yeah, because it's probably like the self-care requisites in her theory. So you
Yeah.
can kind of go down that and kind of see how that's going to affect our patients and maybe develop
What
a
they
tool.
need to be taught before they
Yeah.
go home.
So I bet that that's what it is. It's just discharge teaching is going too fast.
True.
And patients just don't understand and don't know what they're supposed to do.
That's exactly right. When we're trying to get them out the door in 3 days, it doesn't have much time to educate. So
Got 2
we'll
hours to
fix it.
discharge.
That's right. That's right. So we'll have to fix that. So I think I remember, wasn't it water, food, elimination, things like that she talked about?
Yeah, kind of the things that you need to live, I guess.
Okay.
Basic
Things we do.
activities of daily living.
Okay. So let's relate those to congestive heart failure and how we need to make sure our patients are good.
Okay.
Water. May want to start?
Well, I know congestive heart failure patients, they need to have a fluid restriction. So maybe, teaching them how to, measure their water and like maybe, I know I teach some of my patients to use a gallon, start with a gallon of water and then like marking it off and only taking water from that gallon.
Perfect. Okay, so we'll plan to teach the nurses about that. We'll have an education column, and then we'll do a checklist, a discharge checklist for other self-care things.
That'd be good.
Make sure the nurses will document that as well. Food. What do you think about food?
Well, CHF patients a lot of times have to be on special diets and sodium restrictions, things like that. So that would definitely be a teaching point for patients,
Okay.
knowing what they are able to eat and what to avoid.
Sounds good.
You can get dietary to teach them too. I mean, it doesn't have
Good
to all be
idea.
the nurses, Just
Exactly.
use that full nursing system that we got.
That'd also help with the documentation, having a dietary consult, and they can talk about in there if the patients are able to do that. So that's another good point for that. So we'll do the dietary consult for that part. Elimination, another checking urine output, so we can make sure the nurse aides are also teaching them how to check that, send them home with a urinal or something. Make sure we have enough equipment on the floors to document that stuff and accurately document it. I know that's been an issue lately too. And then based on if the doctors need that specific INO whenever they go home, we'll talk about that as well. So that'll be a DME, a supply thing that we'll talk to case coordination about for the urinals and supplies for that.
We
Okay.
could also teach them how to weigh themselves. I mean, with that, they're putting out stuff, so they need to do their daily weight, and they need to know like
To do it
how
at the
much
same time
every day after going to the restroom in the morning, and what how much weight is too much weight to gain overnight, and things like that.
There's also the telehealth program I think that they have that they'll give them a scale and they can call it in and stuff. So we'll talk to those liaisons for the telehealth and see if they can help us with some of the supplies and stuff. What were some of the other food, water, elimination, weight? What else do we have?
Activities, so like maybe exercising,
Okay.
helping them, teach them small programs they can do, just getting up and walking.
Perfect.
A lot of those patients don't even want to do that. And just,
Even if they are doing it for 30 minutes a day or something small to start off with.
So we need to make sure they have education on that. We'll also get PT in on that if they need walkers and canes and that kind of stuff. Absolutely, another documentation.
air.
Air.
HOMO2 is a big problem with these patients. A lot of people get discharged and they need oxygen at home, and I think that that's something we're greatly missing. And they come in
And that would
They
also
can't
be
breathe.
case coordination with the medical equipment.
so we just need to make sure the nurses are walking the patients that oxygen and getting that referral if they need it for HOMO2.
Okay. And then another one that kind of ties in with the STS is hazards like falls. Our fall rates are high related to some of these CHF patients that are having trouble getting around. So it's definitely one thing we'll have to do, fall precaution education with them, have the nurses document fall precautions done, also in-home fall precautions and others.
Like making sure they don't have to throw rugs and
Exactly.
People love those rugs.
different things. Yeah.
Yes,
Catch those walkers and down they go.
Yes, handlebars in the home,
Stairs,
whatever.
that kind of thing.
Mhm.
Showers.
I think there's already a handout on the floor that's related to that, so we'll check into that and see if we can get more copies handed out. And then the other thing I thought about with daily weights was vital signs, making sure they check their vital signs,
Yeah.
have a blood pressure cuff. I think I was told if the doctor writes a prescription for blood pressure cuff, then Medicare will pay for it, I believe.
Really?
So we'll talk to the physician liaison and see if they know anything about that, and maybe the insurance
So we
people.
just need to make sure the doctors are actually getting those orders out there.
Right, exactly. Maybe even implementing a CHF order set
That would be
for the
great.
doctors to use to see if we can get all that in one place so we don't forget anything. To have
And all the
both sides
necessary
of it.
consults for all of these different areas.
Right, exactly. Okay, so we'll talk to the physician reps about that.
We can
Okay.
also like make posters and hold in-services for the nursing staff,
Yes.
letting them know what to look for, what kind of questions to ask to determine what areas these patients need
Mhm.
help in or where they have a self-care deficit.
Right, they're gonna be our primary documentation people for that
Yeah.
that we'll look at. So we definitely need to get them educated, so we'll all have to chip in on that and make sure that we have all the PowerPoint stuff also available. We can get the education team and see if we can get a online quiz for them to do if they need to
Computer-based
review.
learning application.
Right. So we'll look at that. Okay, computer-based.
Maybe we could develop like an evaluation tool for the patients to see if they feel like they can go home and care for themselves and they actually understand
How
what we're
they feel
teaching.
about their self-care.
Yeah, because I mean,
That's a
so
good
often
idea.
our nurses are just like, this is what you're supposed to do, and out the door you go, and the patient's like, okay.
That's true. A lot of patients don't think about what they're going to have to do when they get home, and get frustrated when they feel like they're getting kicked out the door. So that might
And
help.
if it was something that they actually had to answer themselves, it would make them think
about it.
Am I really going to be able to do this?
And if there is
On
a
my own.
deficit, I mean, we can get home health involved. If, you know, they
Right.
can't care for themselves yet, we can, we can get people there to help them if they need it.
Right. That may help our
That would-
satisfaction numbers too.
Yeah, because they feel like they're actually
Mhm.
getting cared for.
Okay. So that'll help patient satisfaction. Well, wow, this Orem is really getting
Really
our
in-depth.
CHF stuff situated. So what we'll do is we'll plan on talking to all the the nurses, dietary, physician reps. We'll try to get this implemented within 30 days, and then we will reassess after 3 months and see if our STS scores are any better.
All right, sounds
like a
good.
plan.
All right.
Okay, next order of business.